let's look at breathlessness. What is breathlessness? Everyone has felt breathless at some point. For example, when we've pushed ourselves to walk or run fast. This is normal. It's our body's natural response when it needs more oxygen and energy to do something that requires physical effort. Getting out of breath when we exert ourselves like this is good. It keeps our bodies strong and fit. However, some of us get out of breath every day doing everyday activities. We find it difficult or uncomfortable to breathe and may feel we can't control our breathing. This is known as chronic or long-term breathlessness. It often develops gradually and lasts for weeks, months or years without us really noticing. Sometimes people also cough, bring up phlegm or feel wheezy. So, what is happening in our bodies when we get breathless? Most commonly, the airflow gets slowed down because there's an obstruction somewhere in our airways between our nose and air sacs. There are many reasons why they may get obstructed, and knowing the reason helps explain the diagnosis. These are the main types of obstruction. 1. The most common reason for obstruction is swelling or inflammation inside our airways or tubes. It happens in asthma and bronchitis, the main cause of COPD. The lining and walls of the tubes are damaged from persistent or recurrent irritation from common irritants such as tobacco or cooking smoke or allergens. This leads to inflammation. Mucus containing dead cells or bacteria, phlegm, can also build up because the cilia can't sweep it away. Coughing is our body's attempts to clear this build-up. Or 2, obstruction due to weaknesses in our air tubes. In emphysema, also part of COPD, at the point where the smallest bronchioles reach the alveoli, the air sac walls break down, creating air sacs that are too large. These larger air sacs are too large for good respiration and squeeze the healthy air sacs down. In bronchiectasis, the air tubes widen too much and the cilia, the little hairs, cannot carry the mucus to our throat very well, so the mucus stagnates. Bacteria then grow in these warm, moist conditions. Or 3, obstruction due to small blockages in the air tubes, from a tumour such as lung cancer. Or 4, obstruction due to muscle tightening, forcing the tubes, our airways, to close up. For example, in an asthma attack, bronchospasm, the muscle around the bronchi or bronchioles tighten, bronchoconstriction. Or 5, obstruction due to pressure on the airways, forcing them to close up, for example from tumours not in the bronchus, air tubes, called non-bronchial. If our airways close too soon as we breathe out or exhale, then the stale air gets trapped and our lungs stay inflated. Our next in-breath stacks on top of our last. If you want to try to imagine how that feels, try to breathe in, hold it in, and then try to breathe in again. Meanwhile, as well as obstruction, our respiratory muscles may not work the way they should. Air trapping can also lead to hyperinflation. The respiratory muscles get stuck in the shortened, contracted breathing in position, which may not be very effective, and so we have to work harder. This means we may have more rapid, shallow breathing when we try to do anything. So we may have to use extra accessory muscles, not used in quiet breathing, to help expand our chest and lungs. These are our neck and shoulder muscles. For example, we see this in some sports where people are exerting themselves a lot. We also see this in people where the air doesn't flow well due to lung damage. However, if we need to move or lift up our arms, our neck and shoulder muscles aren't available for breathing, so our diaphragm has to take most of the load. Airways obstruction can increase the work of breathing as much as 8 times our normal. We may feel a sense of excessive work or effort to breathe, like breathing is just a slog. So we can see that both the airways and the muscles may be working incorrectly in obstructive lung disease. This is why respiratory physiotherapy can help. It helps improve the mechanics of breathing by careful advice on body position and breathing techniques such as breathing control, relaxed deep breathing or pursed lip breathing. These can empty our lungs of as much of the extra air as possible and return our muscles to a better length and our lung tissue to a better state to reinflate and get new air in. This helps reduce the effort of breathing. In addition, weak muscles use more oxygen than strong muscles to do the same work. Therefore, very importantly, rehabilitation and exercise improve the way the muscles work, so we use oxygen more effectively. Restriction. Alternatively, breathlessness may be caused not by obstruction, but by restriction to the expansion of our lungs. Our lungs may be restricted either because they shrink and can't inflate as much as usual, or are squeezed because our chest wall can't move. The reasons could be, 1, our lungs get stiff and can't expand, for example, in interstitial lung diseases, or they recoil too much and shrink. Or 2, the air sacs collapse or join up or are scarred due to an infection such as pneumonia, autoimmune conditions. Or 3, the chest wall is stiff, such as in severe scoliosis. Or 4, weak or paralysed muscles can't move the chest wall, for example with polio or motor neurone disease. People with restricted lung disease need help to increase lung inflation, for example by body positioning to take the load off the diaphragm to help it flatten or contract. Deconditioning. We've now considered obstruction of our airways and restriction of our chest wall as possible reasons for our breathlessness, but it may be due to general muscle weakness, body deconditioning. When we feel tired, we are often less active and so we sit down more. Our muscles become weaker. Therefore, we feel tired and so are less active. The only way to reverse this decline is to become more active. As we explained earlier, talking about respiration, the mitochondria, our energy factories in our muscle cells, generate energy. They need oxygen. If we build more muscle by training our biggest muscles, our leg muscles, we will make more mitochondria and they will use all the oxygen we've breathed in and use it more efficiently to make us feel more energized and stronger. Every muscle contraction uses oxygen. Therefore, if it is used more efficiently, then we have more for our respiratory muscles, so our breathing takes less effort. Deconditioning is also a common problem for people with COPD and is one of the important reasons pulmonary rehabilitation programs work. They help us to gain muscle strength and to breathe more efficiently without using up so much energy. This reduces our feelings of breathlessness. Breathlessness could also be due to stress or anxiety because it is often not only our breathing and functioning involved, but also our thinking. When we are scared, our body reacts to get us ready to fight or run away and develops a faster breathing pattern as it tries to get more oxygen to our muscles. We may get hot. However, we don't actually fight or run away, and our body cells don't need that increased oxygen, so it's important to teach our bodies to relax again. We can retrain our breathing pattern either while we rest or during activity. This sensation can also happen if we have asthma or COPD. This can be frightening, making us anxious or panicky. We may even have thoughts about dying. This thinking can make us tense our respiratory muscles and make our breathing worse, which affects our thoughts. This is when breathing exercises can help to slow down our breathing, decrease the amount of oxygen our body needs, and use less effort to breathe again. A tip for someone with emphysema who is breathless and anxious is to focus on a slow, long out-breath first, otherwise air trapping will be made worse. Sometimes we get suddenly and unexpectedly breathless, known as acute breathlessness, and then it is important to get assessed by a healthcare professional immediately.